Hello, I'm Dr. Pankaj, and today I want to tell you about safe sex and also about unsafe sex, and what are the diseases that spreads through unsafe sex and how we can prevent it, and by preventing we can have a better life. So first of all, I want to tell you about unsafe sex is that when you don't use condoms and when you have multiple sexual partners. So this is unsafe sex, and it is better to use condom at this time. This is a condom, this is a male condom, right? Now exactly today I want to tell you about the medical part of it also, that what diseases though by unsafe sex, there is a spread of what type of diseases. And the diseases are syphilis, gonorrhea, chlamydia, human papillomavirus, AIDS, hepatitis, and there's a long list which I can tell you, but the thing is, we should be aware of how it spread and how we can prevent it, because I don't want that I don't seem like I'm talking to the doctors. I am talking to the general patients, not general patient, to the general people. And this program is for the awareness. And I don't want to discuss each and every disease to the depth that how it spreads and what are the treatment options. But I wanted to tell you in a generalized way that what exactly sexually transmitted diseases are and how they spread and how they are treated and what we have to do if we got it, right? So the most important thing is that they spread by sexual contact, and even I tell you that oral sex is also not safe. Few of the people say, okay, oral sex is safe. I say no, definitely. The mucous membranes, the AIDS, and not AIDS exactly, but yeah, a lot of other diseases, they spread by when there's a breach in the mucous membranes. And secondly, the sexually transmitted disease can also spread from mother to the child during the time of the vaginal delivery, and it also can spread through the breastfeeding, like the AIDS. And the symptoms are very weird. It also depends on the type of the disease you have, but generalized, in a male, when he urinates, when he pees, he feels pain during the urination, if he has a discharge. And in the female also, if she has a pain during the discharge, pain during the urination, or there is a discharge, or she has a rash on the body, don't take it an easy way when you have these type of symptoms. You have to go to a specialist. And in most of the developed country, the thing is you have to go to a family physician, and if he is not capable of doing it, or if he feels that the person needs expert consultation, he refers the patient to another doctor. But in most of the developing countries, the patient directly goes to the specialist. So in a male, you need a urologist, and if it is a female, she needs a gynecologist if she has these type of symptoms. And one thing I forgot to tell you, that sometimes there are no symptoms. The patient is asymptomatic, and even then also, he or she can spread the disease. So it's not important that the patient has symptoms, then he can spread the disease. And sometimes the patient is not aware of that she has the disease, and the disease takes its course, and it can change into severe form that can lead to infertility, that the woman is not able to give a birth to the young one. There are diseases like that when the severe form takes place. And these type of diseases can also lead to cervical cancer, like in case of human papilloma virus, that is one of the important causes for the cervical cancer. So we have to take measure. And what is the best treatment? The best treatment is the prevention. Be monogamous. Be sex with one partner or use condoms. And then you have one thing in your mind that I had a sex with, somebody asked me that I had a sex with one partner and still I got the disease. And at that moment I can say is that no doubt the other partner, your partner could have 6 partners. But at the same moment, what we can do is what is in our hands, and that is we can use condoms, and we can go for one partner, and when or you have the symptoms, you go to a doctor. And the doctor, I told you, in a male it goes to a urologist, and a female it goes to a gynecologist. And the type of the treatment depends on the type of the disease. Like usually they go for vaginal creams, vaginal pessaries, or they go for antibiotics for a course of 7 to 14 days or more than that, depending on the disease. And they will also go counsel you for the best and safe sex practices. But the best treatment again is be monogamous, use condoms. That's good. Okay, I want to show you some slides and which can help you to take a better decision, right? So this is condom. It's good if you can use it. And this slide shows that you should. It's good if you have do sex with one partner, or if you have a trustworthy relationship, you know, and be monogamous. That's the best treatment. And this guy has shows that he is following polygamy. There are a lot of sexual partners. And okay, so use condoms. And if you have any other questions in your mind, you can write to me at www.ggnclinic.com. On my email, that is pankaj@ggnclinic.com. And you can also contact me through my website, that is ggnclinic.org. That is www.ggnclinic.org. Thank you.